Hello, my name is Jonathan Bowen from P.E.M.F. I would like to spend a few minutes discussing a revolutionary therapy called P.E.M.F, or Pulsed Electromagnetic Field Therapy. P.E.M.F technology is based on the geomagnetic field surrounding the Earth. It extends from the Earth's interior well into outer space. Scientists believe the Earth contains an outer crust, a mantle, and a liquid core with a solid core at the very center. The geomagnetic field is generated by the Earth's core. The rotation motion of the iron alloys in the outer core creates this geomagnetic field that is between 25 and 65 microteslas. This creates the north and the south poles that we use to navigate with a compass. But we're not alone in this method of navigation. Animals also use magnetoconception for navigation. The Arctic tern, for instance, travels 71,000 kilometers or 44,000 miles round trip from Iceland and Greenland to the Antarctic. Monarch butterflies migrate from Canada to Mexico, covering thousands of miles over generations. And certain bats use magnetofields for orientation. The human body is designed to use Earth's geomagnetic force at a cellular level. This fact was highlighted when extended space travel became possible. It was the return to the Earth that really clued scientists in. Astronauts returning to Earth suffered from muscle atrophy and bone density loss. The bone density loss was dramatic. It was 1 to 2% that their bones decreased per month spent in space. Astronauts were unable to walk when they first returned to the Earth, and they had to be carried from their landing craft. NASA and Roscom, the Russian equivalent, both conducted studies to determine the cause. The lack of the Earth's geomagnetic pull was determined to be a key factor. P.E.M.F, or Pulsed Electromagnetic Field Therapy, was found to be a solution. Ben Philipson, the inventor of the Curatron, developed a device to assist with bone density regrowth for astronauts. This technology has now been made available by Curatron, and it can help with many medical issues. Here is the reason why. The human body runs on electrical current. Without electricity, our bodies cannot function. We measure life by measuring the electrical current running through the body. Heart activity is measured by ECG or EKG, electrocardiography. This measures the tiny electrical charges in the skin when the heart muscles depolarize during each heartbeat. If there's no electricity, there's no heartbeat, and we are no longer living beings. Doctors and paramedics will try to resuscitate a person with no heartbeat using a defibrillator, an electric stimulation shock. Well, the heart isn't the only part of the human body dependent on electricity. The human brain is a complex processor of electrical signals. The neurons inside the brain communicate through electrical signals. The nerves then send these signals throughout the body to the cells, and the electrical signals are translated into actions. Brain activity is measured by EEG. It measures the electrical brain waves. If there are no brain waves, the patient is pronounced to be brain dead. Well, it isn't just the brain that runs on electricity either. Each of the 100 trillion cells in the human body are powered by electrical energy. The cells are mini engines powered by fuel from nutrients we digest, mixed with the oxygen from the air that we breathe, and ignited by the electrons stored in the cell batteries, all driving the metabolic process. The cell batteries are called the mitochondria. They supply the electrons to ignite the metabolic processes, without which cells simply cannot function. The mitochondria power generators generate something called adenosine triphosphate, or ATP. And ATP is the battery that powers the cells. Without this ignition from the power generators, the cells will die. Our bodies depend on electricity. If enough cells die, our organs cannot function, and consequently our bodies will die. Once the ATP has been used, or has used up all the power within its cells, the spent battery cell is called ADP, or adenosine diphosphate. ADP, though, can be recharged and turned back into ATP batteries by the mitochondria, using an infusion of energy that comes from the food we eat and from oxygen. In an aerobic state, meaning with oxygen, the mitochondria can create up to 38 ATPs from every sugar molecule metabolized. However, in an anaerobic state, that is a state without oxygen, the mitochondria can still create ATP, but only at a rate of 2 molecules or 2 ATPs per sugar molecule. The byproduct, though, is also lactic acid, which causes muscle cramps in athletes. One other electrical feature of the cells worth mentioning is the transmembrane potential, or the TMP. The human body is designed to carry a positive charge. According to Nobel Prize laureate Dr. Otto Warburg, cells maintain a voltage across their membranes. Each cell is designed to have a positive charge on the outside and a negative charge on the inside. A healthy person has a cell voltage of 70 to 100 millivolts. However, cells will power down over time. Often we hear people say, "I'm out of energy," or "I'm running low." Well, this is because their cells have lost their positive charge. Due to the aging process, perhaps stress, an unhealthy diet, or the toxic environment in which we live. Chronic illness was seen in people with cell voltages of 30 to 50 millivolts. Cancer is found in patients with a voltage of less than 15 to 20 millivolts. It is interesting, though, that we never hear of cancer of the heart, the most highly charged organ in the body. Well, the loss of the positive charge can cause big problems in the body, and especially in the blood. Blood requires a positive charge to be effective. It absorbs oxygen and nutrients and delivers them to the cells. Blood removes waste toxins left over from the metabolic processes. Under a dark field microscope, we can see what properly energized blood is supposed to look like. Healthy blood cells are free-floating because the cells are positively charged and they repel each other. However, if the blood cells lose their positive charge, they begin to clump together in something called the rouleau effect. This reduces the surface area of the cell and its ability to absorb oxygen and nutrients and deliver them to the cells and remove toxins. As cells power down, the rouleau effect increases. If more than 8 cells clump together, their combined surface area is reduced by 50%, reducing their effect. The blood cells pick up oxygen in the lungs and discard CO2. They absorb nutrients in the intestines. Toxins are picked up by the blood and filtered out through the liver and the kidneys. The blood distributes nutrients and oxygen and discards toxins at a capillary level. The capillaries are very small and will only allow one blood cell through at a time. Blood that is clumped together due to the rouleau effect will not be able to do its job. This affects all the cells in the body because all the cells rely on the blood to be serviced. The blood brings the oxygens and the nutrients, the fuel that the mitochondria use to generate ATP energy to power all the cells. The blood is powered down, every component of the body will struggle to do what it was designed for.